Hi, everyone. My name's Braxton. I'm with UFLTV, and today I'm interviewing Mitch Acton. Do you want to introduce yourself, Mitch?
Yeah, thanks, Braxton. It's nice to be on here, and I appreciate the offer and the invitation. Yeah, so my name's Mitch Acton. I'm a family systems therapist. I'm also the clinical director at Family Advocacy Center. We're located in Murray, Utah, and we primarily see clients that are involved in the family court system. About 99%. I don't know if that's the actual number, but the overwhelming majority of our clients are involved in family court and are court ordered for either court ordered reunification therapy or family systems therapy, or something under that umbrella. And so that's what we specialize in, and those are the clients we see.
Wonderful. I have a couple of questions for you about that subject.
Great.
So awesome. So my first question is you hear the term parental alienation used a lot in child custody disputes. Is there a formal definition of this term in the mental health profession? And if not, what terms are used?
Yeah, I don't know the formal definition right off the top of my head, but there is a formal definition within the family, I guess, family therapy arena. Some things that would be consistent with alienation is that it's largely parent involved, or someone is involved that is actively doing something that would be considered an alienating behavior. So, for example, that could be actively telling some of the kids in the family, oh, hey, your parent is this, doing this, this, and that, could coming up with a narrative that could be totally fictitious and not true. That would be an example of alienation, or actively doing things that would keep the children away from their other parent. That would fall under the definition of alienation, and it's usually parent involved. One of the things that we see a lot of is estrangement, and that's a term that we use quite a bit as well. And I would actually say most of the time of what we see at our clinic, estrangement seems to be a better word than alienation. There's certainly times where alienation is happening, but estrangement is usually there's a justifiable reason or an understandable reason of why there has been a break in the parent-child relationship, and it's usually largely to do as a result of these families have gone through a divorce or are going through a divorce, and they're highly conflictual. And so it could be one parent has done something to really damage the relationship. Certainly on the extreme end, there's abuse, whether that's physical, sexual, emotional abuse. It could be a history of just consistently poor interactions between a parent and child, that have led to resentment and an estrangement in that relationship. Um, it also could just be due to seeing the parents in conflict with each other, kids spending a certain amount of time at one parent's house, and kids end up kind of getting sucked into the middle of it, unfortunately. And then they something that will happen a lot is, we'll use the term sometimes, the loyalty contract. For whatever reason, kids will feel like, oh, if this is the parent that maybe needs the most help, or maybe is the victim in this case, um, then they will align with that parent, feeling like they have more of a responsibility to take care of that parent's emotions and side with them, because they need the most help. And I say that in quotes, like that's just how they perceive it. That's how they experience it. And so that kind of creates this estrangement in a relationship. And so, yeah, I'm sure we'll go into this more, but a lot of the treatment around that is balancing out the thinking of how the kids are thinking towards both of their parents. So it's not so black and white and off balance.
Yeah. You brought up parental estrangement and alienation. A lot of the time, these terms get thrown up in a divorce. How are they different from each other?
So kind of like what I was alluding to earlier, like if there's estrangement, there's usually like a justifiable or an understandable reason of why there's a break in that relationship. Alienation is there's active, intentional behaviors going on that are creating a break in that relationship. Does that make sense? Or
Yeah, that makes sense. Absolutely. So one is estrangement is what has happened, and alienation is the active process that a parent is taking to push
Correct.
to create that wedge.
Right. Right.
Yeah. So, what do you look for? I know you're not specifically looking for this stuff, but what are the kind of things that clue you in that alienation or estrangement is happening?
Um, Assessing and diagnosing the family system is crucially important. So that for us or for myself as a family systems therapist, when I'm meeting with a family, I'm really trying to get as much information as I can. And so that means I'm meeting with each member of the family system. So both of the parents, usually separately, we usually don't come together because it's a high conflict divorce. It's not great getting both of them in the same room at the same time usually. So uh, doing kind of my assessment interviews with each person, including the kids in that case, and then based off of kind of what they're bringing up or saying, that might clue me in um, to certain things that might be going on in the family dynamics. If, for example, something that's always kind of a red flag for me is if kids are using very parentified or adult-like language, they're saying things that don't seem developmentally um, appropriate for a kid, that always is kind of a red flag to me of like, okay, maybe that's something that could be coming from a parent. Of course, I then need to kind of figure out, is that something they overheard? They just kind of happened to overhear, or is there more like some coaching that could be going on in this case where a parent is coaching them to say certain things? Um, but the assessment piece is really important, and that usually also requires me talking to other individuals as well, because oftentimes clients will come into my office and they will um, I mean, it's coming from a place of they're very hurt, they're very wounded as a result of the situation, and so they're trying to figure out a way to survive and just navigate the situation. Um, and that doesn't necessarily always translate to totally telling the truth or giving an accurate picture of what's going on. And so uh, going beyond just collaborating with each member of the family, I'm collaborating with family law attorneys, guardian ad litems, other treating clinicians that might be involved. If there's someone doing a custody evaluation, it could be touching base with them as well. But anybody that's kind of a part of this professional team helps give me more of a well-rounded picture in terms of how can we start to see really what is going on and help me figure out where's the dysfunction in the family dynamic and how do we shift to something more functional.
I know you said that to kind of backtrack a little bit. I know that you said that the vast majority of the cases that you deal with are kind of these divorce cases. How often does parental alienation or estrangement occur in those situations?
Oh man, I don't, again, I don't have exact numbers for you, but I would
Yeah.
say almost all of them. In almost all of them, that is happening. And it seems to be this phenomenon that happens with high conflict divorce, where there is parent-child estrangement issues that happen. Yeah, very rare for me to see a high conflict divorce situation coming in where there isn't some type of estrangement. On the extreme side of things, it looks like uh, kids are not going to other parents' house. They're having no communication or speaking with that parent at all. And maybe that's gone on for years. On the lighter side of things, there could be still some constant disruption within the family dynamic that leads to maybe one of the kids always wanting to leave and go to the other parent's house, or maybe running away, or calling their parents, say, hey, can you come pick me up, I don't want to be at so and so's house right now. But they are continuing to follow the custody arrangement for the most part and go over there. But in all of the cases I think that I see there, it's usually somewhere in between those two.
Okay. And how would you deal with this in the family therapy setting? I know you said it happens a lot. What are the kind of specific therapies that you would use to deal with this?
Uh, yeah, there can be a lot of different modalities that you could use that would be helpful. I First off, I always recommend to folks that they do get individual therapy to support them in this process. Um, that can be invaluable in terms of building a base of coping skills. So that's where you could use some more specific modalities like cognitive behavioral therapy, dialectic behavioral therapy. Certain trauma therapies can be really helpful if that's something that the family's experienced. So things like EMDR or ART or polyvagal theory that could help work through the emotional distress piece so that when the family is coming together for family therapy sessions, they have coping skills. Um, the if emotions were to rise, they have the ability to kind of regulate themselves, or they're already kind of regulated as they come in, and that allows for more work to be done in a family therapy setting. Um, Also, individual therapy can be really helpful for kids who are very resistant to reconnecting or reunifying with one of their parents. Um, like I said, a lot of this is court ordered, so the kids don't have the choice in that aspect. You know, they're kind of being ordered to participate in the therapy process. And I find that kids really want to be able to, especially teenagers, want to feel like they have some type of say. And the individual work around that is largely around what are my relationship boundaries? How do I understand the depth of relationship that I'm going to have with this parent? And knowing I do have choice over that. I may not have choice over whether I have to go over to this parent's house legally because of the custody arrangement, but I do get to choose how close I'm going to be with this parent, and that is often a helpful part of individual therapy for the kids that helps prepare them for the family systems process. Um, yeah, once you get into the family systems process, it is getting everybody together. Something we use specifically at our clinic is something called relational dynamics therapy. Um, and just to give you kind of a visual of how that looks, we have a mat that we lay out on the floor that specifically identifies roles and positions that families find themselves in when they're distressed. We talk about what does it look like when things are gelling, things are going smoothly for the family, and then what happens when things aren't going smoothly, and how does the whole system react? And that's what we're really trying to help families with too, is get away from the blame game and labeling, well, it's all this person's fault that this thing happened, but really look at the system of the family is impacted and interacts with each individual member of that system. And this intervention has been hugely helpful with families that we've worked with to get out of the blaming side of things and just look like, oh, okay, so when this thing happens, I respond in this way. And in order for things to feel smooth in our family system, the kids are going over here, or the other parent is now shifting to this position. And the whole idea behind it is that we have this need to feel balance in our relationships, that if things feel out of balance, our nervous systems get dysregulated and we start to get into that fight, flight, or freeze mode. And so if someone is distressed, well, the other folks in the family will move to these different positions to try to balance that out, to try to get everything to feel calm again. And that's one thing that I've seen be hugely helpful that goes a little bit beyond just the cognitive or the theoretical level, if you will. If we're going to sit and we're going to talk about the dynamics, this really allows people to visualize it and actually move around this mat and kind of experience walking through a scenario. What does that feel like? It can be pretty powerful, and some pretty impactful insights can happen. So that's one of the main things that we do at our office. Like I said, of course, it really does kind of depend on what the individual is needing or the family's needing. Um, but when it comes to the family systems approach, it is a systems approach. We're looking at what is wrong with the system, not what is wrong with this individual within the system, if that makes sense.
Yeah, that does make sense. I know you said that a lot of the people who are there are court ordered to be there.
Right.
What would they need to do in order for the therapy to be successful? Because I know people who are court ordered, they don't really want to be there. So if somebody is inclined to actually believe in the therapy and try to make it work, what can they do to give it the best chance?
Yeah, that's a great question. Yeah, there's this aspect of it being court order is like, oh, well, I have to do this. And oftentimes the only person that wants to is the person trying to reunify with their kids. And largely everyone else, the other parent, the kids, they're more resistant to it. They don't want to do it. One thing I want my clients to understand is, yes, you may be court ordered to do this, but you are a voluntary client at our clinic. So I'm not necessarily saying you have to be here. You know, there is a court order saying you need to do this type of therapy, but you are voluntarily choosing our services if you're coming to work with us. And that can, right off the bat, can kind of help them decide or feel like they have a sense of choice, which can be helpful. Like, okay, yeah, no, I'm choosing to go with this clinic. I like how they approach things, and that can help get a little bit of buy-in right off of the bat. I do kind of go back to my previous answer when I was explaining relational dynamics therapy. There's this experiential component of it that is largely helpful rather than maybe your stereotypical idea of therapy or kind of what comes to mind when people are thinking of therapy about I'm going to go sit or lay on the couch and we're just going to kind of talk about my feelings. I think the therapy that is the most effective has some type of experiential component or is something that is engaging. Another large piece of what we will do is we'll go do therapy in the home or have time spending time in the home with these families and actually get to see them in that environment versus the therapy environment. Or we'll do sessions that are out of the office with kids and parents, especially if they're trying to reunify. What happens is for whatever reason, either it's because of their own experience or because they're hearing it from someone else, these kids largely have this distorted negative outlook towards this parent. And when we're trying to balance out that thinking, well, one of the best ways to do that is to actually have a positive experience. And so the homework assignments or therapy assignments we'll give families is, hey, go get ice cream together, or hey, let's go to the arcade down the road, and you guys can do something that feels like it's a little bit more natural. It doesn't feel overly therapeutic, and it actually allows them to kind of re-experience, like, oh yeah, my parent is not all good or all bad. Like there are positive and negative things to everybody, and it does help to kind of balance that out. But the way that it does end up being the most successful from what I've seen is when folks have an experience, when families have an experience rather than just kind of talking about it. Does that make sense?
Yeah, that makes sense. Oh. So you brought up custody evaluations earlier. How does parental alienation and the therapy you provide factor into that custody evaluation? You said that you consult with them to kind of get a whole picture. How is that specifically investigated?
Well, I guess I'll first start off by saying this is I'm not a custody evaluator, and so my role as the family systems therapist is a purely clinical role, where custody evaluation is a forensic role. So there is a little bit of a difference there. So I apologize. I may not be able to give you the most accurate information
Yeah,
about that, um, but I will tell you in terms of what I know. I know. I mean, custody evaluations are very extensive. And it usually requires a lot of time spent in various situations, including the home environment, assessing and spending time with these families to specifically see if these dynamics are coming up. I think custody evaluators, from my perspective, have a better opportunity or more of an opportunity to see is there alienation going on because they are spending more time in those environments with the families versus where my role as a family systems therapist, you know, we have a specific treatment plan that we're following of trying to, again, move from conflictual communication to more collaborative, moving from dysfunctional to functional. Um, so yeah, that's really all I got, I guess, or that I could offer on that without kind of
yeah,
going too far out of my scope of practice.
yeah. Um, for parental alienation, is it something that's easy to hide? Would you think that a custody evaluator would be able to be fooled by something very subtle, or is it something that they could even, pull the wool over your eyes?
I certainly there's the chance that that could happen. It seems, in my experience, it's been unlikely, and that usually happens just because family systems therapists, custody evaluators, if you're doing that work, you're getting trained on that specifically, to kind of look and be aware of these things. Um, that does make me think of the AFCC and being AFCC informed, which is the Association of Family and Conciliation Courts, which our clinic and all of our clinicians are members of the AFCC, and we're actively engaged in that. But that has a specific set of guidelines and trainings for being a court involved professional and working with these families. Again, that gives you just maybe a little leg up than the average mental health professional in being able to identify these things, because we know these are common dynamics that happen with families in this situation. So I find it rare that someone could hide it very well. Usually, if you're doing this process, if families are going through this process, it's likely that it comes out in one form or fashion. I also think people don't think they're necessarily as sneaky as they think they would be.
I would agree.
Yeah.
Do you ever get the impression that courts are kind of dumping their problems with family dysfunction onto therapists? So, say like a family has a minor dysfunction, and the court just rubber stamp saying, "Yeah, go to therapy. You guys are required to go to therapy," as a way for them to just kind of feel good about doing something.
Yeah, I think dumping might be a harsh word to use. I do think that courts oftentimes, especially if it is, I mean, you bring up minor dysfunction, and maybe they do kind of still go that route. I think with high conflict situations, I think there's a lot of people, especially in the legal profession, that don't necessarily know what is the best way to handle this. I have legally, I have all the training in the world and understand what can be helpful from the legal side of it. And where I think therapy can really complement that is like, okay, even if something legally is decided, um, the family still has to deal with the relationships. It doesn't necessarily solve all of the problems. And so I do, in a sense, feel, especially with the high conflict situations, I think everyone's kind of trying to figure out how do we, what's the best way to help these families? And so therapy has been a more common route to go. That being said, there's research that supports that therapy can be effective and is effective in helping these families, and in achieving some long term stability. I might be biased as a family systems therapist, and I choose to do this work, um, but I generally would recommend that families do give therapy a shot, and trying that. That would most likely will be the or the worthwhile investment in this case, if they are hoping to see some long term changes.
That's wonderful. Um, in your therapy sessions, how often does one parent try to frame themselves as good or the other one bad, or vice versa? How often do they try to like play you against the other?
It's very common. Yeah, it's very common, and there could be some intentional manipulation or being intentionally manipulative in that way, and that is something to be aware of what is the motive of this person underneath. Like, is something you'll see for sure is if a parent feels like they could get a therapist on their side to assist their legal stance, it happens quite a bit. They'll want to do that. And so that really does require the therapist being trained and knowledgeable about that, and being able to kind of differentiate and hold that line of, I'm not here on your side to aid your legal case. I'm here to address the dysfunction within your family. But it is very common, whether it's knowingly or unknowingly, like I said, intentionally manipulative, or again, they're just in this place of hopelessness or fear, or really heavy emotions, and they're just trying to survive the situation. They might even do things like that unknowingly, in terms of like, I just need help. Um, and so, yeah, it kind of ranges the whole gamut. But again, that's one where I would say most families I work with, that is happening. Something within that range is happening with both the parents.
Okay. Um, you mentioned being a court-approved therapist and that you work, you're AFCC informed. Are there any kind of other qualifications that make you a court-approved therapist, or is there any kind of specifics that you need, specific trainings or courses you need to take in order to become a court-approved therapist?
As far as I know, there's not anything specific that you need to complete in terms of coursework. Aside from having just kind of the standard state guidelines of being a licensed mental health professional, kind of whatever that license is okay. Um, and even with the AFCC, it's not like a certification. It's not something that you necessarily get certified in, but it's when you are informed, you are understanding of what are the guidelines of the AFCC, what does the research base suggest about families that are involved in the family court system, and having an awareness and knowledge of that. I mean, a plug for the AFCC, they put out great learning and teaching materials and these webinars that are very helpful that if you are a member of the AFCC, you have access to these things to kind of get training in these up-to-date informations as well as the conferences and things that they offer. However, there is no like certification necessarily in doing that, or depending on kind of what role you would like to have. Yeah, if you're a forensic role, there might be some certain things that you can do training in, like custody evaluations or mediation or some parent coordinating, things like that you could do. But in terms of like part of your like mental health degree, your master's degree, as far as I know, there's nothing specifically to get to be a court informed or a court appointed therapist.
All right. I think that was all of my questions.
Well, great.
Awesome.
Thank you, Braxton. I appreciate you having me on. It was a pleasure to meet you and a pleasure to
Yeah,
chat about this topic. It's something I'm
yeah,
passionate about and really believe in and why I do it. So yeah, thank you.
of course. And I think getting this information out is going to help a lot of people because a lot of people are going through a divorce for the first time and just don't understand what's going on. A lot of it is
Yeah,
either hyperbole, where they've only heard horror stories, or they really just don't know what's going to happen next.
right,
So,
right. Yeah, a lot of people don't know that this type of therapy exists or that this resource
yeah,
is.
yeah,
And the unfortunate thing is, yeah, there's not a lot of therapists that do this specific type of work. So, yeah, I certainly hope that, yeah, the word can be spread and that people can know, like, hey, there are things that can